Multiple sclerosis, or MS, is a nervous system disease that affects the brain and spinal cord. John Charcot, also known as the father of neurology, discovered the correlation between the clinical features of MS and the pathological changes noticed post-mortem or after death. During this time, all neurological disorders were lumped together in a group they called nervous disorders. In 1868, Charcot made a detailed description of MS, along with the first drawing showed the earliest insight into the pathology of MS involving the brain and spinal cord. He later described the different forms of MS. Jean Cuvier was the first to discover the clinical findings of MS from a patient. MS occurrences are rare and affect about 400,000 in the United States. Researchers have discovered that the risk of MS increases the further one gets away from the equator. In the United States, MS is more common in the northern states and the southern states. MS is 3 times more likely to occur in women than in men. About 2.5% are diagnosed in children under age 16. Most are affected between the ages of 20 and 40. The etiology or the cause of MS is unknown, but 2 factors are believed to contribute to the development of MS: genetic factors and environmental factors. Although it is not hereditary, there still seems to be some genetic link. Researchers are investigating whether certain toxins, infections, and vitamin deficiencies may play a factor in triggering MS. Certain vaccinations have been accused of causing MS, but there have been no definitive evidence. Certain risk factors include age, gender, race, ethnicity, and family history. Those between the age of 20 and 50 with an average age of 30 are at risk and occur most in Caucasians of Northern European descent.
There is no one symptom, physical finding, or laboratory test alone that can diagnose MS. There are several strategies to determine if a person meets the criteria for MS. Strategies used to diagnose are medical history, neurological exam, MRI, evoked potential, cerebral spinal fluid analysis, and blood tests. From these, the doctor must find at least 2 separate areas of CNS and evidence that the damage occurred at least 1 month apart and rule out all other possibilities. There is no specific medical treatment for MS. There are medications that can be taken to reduce the disease progression. Some medicines are avoxanax, copaxone, and Gilenya. Symptoms can also be managed using rehabilitation programs for different functions. Because there are no ways known to prevent MS, the public health strategies are secondary prevention strategies that include ways to minimize the symptoms. This includes exercising, have a healthy, low-fat, high-fiber diet, and managing stress levels. It also focuses on wellness, which encompasses physical, emotional, social, and spiritual well-being. MS falls under the Hearing and Other Sensory or Communication Disorders in Healthy People 2020. The goal is to reduce the prevalence and severity of disorders. Substantial improvements have been made in areas to help people with severe disorders to communicate. Researchers are also identifying the genetic components of many disorders, which may lead to earlier or more accurate diagnosis, clarification, and long-term clinical intervention.